Everyone, Ken McLeod with you from the WBZ studios. You spent the better part of the last 90 minutes watching a federal coronavirus task force briefing from Washington. Now you can see we're getting an update from the state and Governor Charlie Baker.
Conversations that our administration's been having with the U.S. Army Corps of Engineers, the Commonwealth's testing capacity, and our efforts to open emergency childcare centers. Earlier today, we had a very productive conversation with the U.S. Army Corps about ways they could potentially support the Commonwealth and its citizens and its healthcare system during this outbreak. As most people know, the Army Corps has expertise and skills in designing and building critical infrastructure in a big hurry in times of need. Based on our conversations today with the Corps, we got a sense for the kind of work that they can do here in the Commonwealth and identified, along with several other folks, including people from the private sector, facilities that could possibly be either converted or modified to provide additional medical care capacity as we ramp up to deal with this virus. Our command center, led by Secretary Mary Lou Sudders, has been in constant communication with the hospital community to understand and assess the needs and the expectations and to scenario plan around capacity for managing COVID-19 care with our existing capacity and including alternative medical facilities. The command center is also working closely with the hospital community on the plans that they're pursuing to develop additional capacity within their four walls. Today's conversation built on this effort to better understand what type of structures may be necessary to best accommodate Massachusetts' needs and how the state can contribute to a quick response. We've already identified a number of possible sites which we want to work forward with the Army Corps and with the folks in the healthcare community to pursue further, and we've also discussed several other logistical components that we'll continue to work through with the Army Corps as needed. The Army Corps obviously has tremendous talent and a ton of experience in doing this type of thing in a number of other places around the country and around the globe. And this is obviously a mission that our National Guard could assist with as well. The Command Center will closely monitor this issue and make sure that we're doing all the things we need to do to assist our healthcare community as they and we work together to ensure that we have the capacity we need to serve our residents. I also want to take this opportunity to share a status update from the Command Center on testing. The Command Center is monitoring the Commonwealth's testing capacity and the ways in which we can increase testing for more residents. And we have made some significant progress this week. Over the past 2 days, the number of tests completed in a day in Massachusetts has nearly doubled, from 520 on Wednesday to 962 yesterday. That represents about an 85% increase in the number of completed tests. We'll post more data this afternoon to reflect the last 24 hours. Since Wednesday, testing capacity generally has also grown. Testing capacity for the state labs and commercial labs was just under 700 on Wednesday and increased to 1,144 as of Friday. This represents an increase in capacity of almost 65% for our testing capacity over a 48-hour period. And I can tell you, based on my own personal discussions with the commercial lab community, their capacity to test is going to continue to grow in significant ways over the course of the next several weeks. I want to remind folks that as the testing numbers go up and as the criteria by which you can be tested expands, we certainly expect that we'll see an increase in the number of positive test cases as well. Today, Massachusetts opened the first privately owned urgent care center in Massachusetts and started to conduct drive-through testing for COVID-19. As we speak, the Waltham AFC urgent care location has cars with pre-screened patients waiting to be tested. I want to commend the owner, Dave Adams, a former Marine and local business leader, and the City of Waltham for working together with a single purpose to stand this facility up so quickly. The new site is in addition to the CVS Shrewsbury pilot location announced on Thursday, one of 40 CVS drive-thrus in the United States, and they will play an important role in our overall effort to expand testing capacity across Massachusetts. As a reminder, for people with questions about tests, it's important to first contact your medical provider. If you think you have some symptoms, as we've said many times before, you should stay home and follow your healthcare provider's instructions. A big part of the effort to prepare for this is to keep people who don't need to be in the hospital and in the doctor's office out. This will allow our healthcare professionals to do their jobs for those that do. Last week, we announced that effective Monday, all early education centers and family child care providers in Massachusetts would close. We know that child care is an especially critical piece of emergency service and that allows our frontline workers to continue their battle against COVID-19 and to continue their work. And there are times when our families are on the front lines and don't have another option for their children. So starting Monday, we will open, as many other states have, some selected sites to serve as emergency drop-in child care services for families with no other options to continue going to work to ensure the safety, health, and welfare of the Commonwealth's residents. Child care is meant to be for those who must report to work. Outside of the obvious emergency responders and medical professionals, this will include critical service workers like grocery store employees. As of Friday, we had over 300 sites that were ready to start operation on Monday. We expect more to come online eventually, but this needs to be implemented safely, and the sites should only really be used as a last resort. All of them obviously will be operating under the policies and procedures that we put in place as part of our oversight process several weeks ago. For more information on programs offering new services for the duration of the state emergency, please visit the Early Education and Care website on mass.gov. This information will be updated on Sunday morning. In closing, I want to thank the residents of the Commonwealth for their resiliency throughout this outbreak. Lieutenant Governor and I have been fortunate over the past 5 years to get to know the spirit and determination that this particular Commonwealth has for its residents and for its family members. And that dedication has not been dimmed throughout this unsettling time. Several months ago, I was asked to speak at a Shabbat Shalom ceremony at Temple Emmanuel in Newton. A lot happened since then, but they asked me if I would be willing to come last night for my scheduled visit and speak through live stream in an empty temple. There was a lot of music because their ensemble and their cantor performed, and they were beautiful. But having a chance to speak in an empty temple on a Friday night that would normally have been packed from one end to the other with people practicing their faith reminded me in a very personal and specific way some of the things that we need to find a way to preserve despite social distancing. Now, when we issued our order to dramatically scale back public gatherings a week ago, the first community the Lieutenant Governor and I heard from was the religious community. The second one was the community that manages funerals. I can't think of 2 times in someone's life where you would want the ability to be physically close to those you care about most than during a time like this. And I can't imagine church and someone's funeral being any more special than in moments like this. And as I looked out at that empty synagogue, I thought a lot about all the people who wanted to be there physically and were working real hard to be there spiritually. And the conversations the Lieutenant Governor and I have had with folks who haven't been able to attend the funeral that they wanted to attend for their loved one because of the constraints associated with our emergency orders reminded both of us of the difficulty and the trade-offs that are associated with every one of these decisions. But many people who have had that opportunity for physical closeness taken away from them, and that opportunity for the solidarity that comes with being able to pursue the gatherings on a regular basis, or even on a one-time basis that means so much to them, are finding ways to persevere and work through it. And there's no question that in this time, social distancing, personal hygiene, and all the issues we've talked about handshakes and high fives and hugs, simply can't be part of our daily routines. But time and time again, I've seen the people in Massachusetts make adjustments, deal with it, act accordingly, and step up. And I expect nothing different from this point forward. And with that, happy to take questions on those issues or others.
What would need to happen? What would you need to see at this point in order to do that? You also said that your decisions are informed by your advisors and other experts. What specifically, if anything, have you heard from them at this point that's allowed you to decide that at this point shelter in place is not the appropriate step?
Well, let's start with shelter in place as it's been pursued in other places. Just to be clear, you can still, in all those other places that have issued orders like that, go to the grocery store. You can still go to the pharmacy. You can still go for a walk. In none of those places is the fundamental position of government, state or local, that people should spend all of their time inside. So let's just start with that. Secondly, what we've said all along is that we will make decisions based on data and guidance that we get from public health experts, from state and federal authorities, and based on the facts as we understand them on the ground here in the Commonwealth. That's been our position all along, and it's going to continue to be our position.
Governor, would you say that some of the towns who have already ordered some sort of suspension of major retail, such as Somerville, are you in support of those towns? Some of them say they were kind of waiting on the state's act, and because the state didn't act, they just took initiative on themselves.
What I believe our job is to do the best we can to create a framework to deal with this virus. And last Sunday, when we basically said takeout only for restaurants or other food serving entities, no gatherings of more than 25, and a whole series of other initiatives that were basically designed to dramatically reduce social contact and gatherings here in Massachusetts, we viewed that as a pretty aggressive message to the people of Massachusetts based on guidance we were getting from the folks at the command center and others about what we should do here to stop the spread or reduce the spread of the virus, and that we would continue to make adjustments based on facts as they became available. Now, many locals have made a variety of decisions within the framework of what we've established, and that's perfectly appropriate. I mean, the Lieutenant Governor and I, for the past 5 years, as former local officials, have said one of the things we think is most important is that we set a framework, but if locals want to do things within that framework, that's their call, because they know their communities better than we do.
Governor, today we're learning that there's a prisoner that tested positive for COVID-19. What do you have to say for other people serving time and people who work in prisons who are worried?
Yeah. Do you want to speak to this one?
So there was an individual at the Bridgewater Treatment Center who tested positive. The Department of Corrections has followed all the protocols around isolating the individual, doing the contact tracing, the people who the individual had come in contact with. All of those individuals, if they were staff, went home and are being tested. The place was disinfected. So we believe that the treatment center has followed all the protocols that we do in any other facility where you would have a patient, a person, or in this case, an inmate who was tested positive.
What about in any other facility? Just to follow up to that, I mean, how do you prevent a further outbreak, I guess, and if it were to get worse? I guess it's kind of a hypothetical. Would you isolate these inmates as best you can, not let them out? How do you kind of preserve human rights with, fighting this virus?
Yes. So again, anyone who is symptomatic or suspected, right, is tested, regardless of the setting, tested, and sort of quarantined or isolated, whatever term you would like, pending the results. And these are results that go to our state lab that turns them around quickly. And then you do, like, who were you in contact with? So the very first thing you do is, like, who are the people that you were in contact with? And they are immediately sort of isolated from the person. Obviously, a prisoner, they're isolated because they're not released. Staff would be sent home. And then it's a 14-day quarantine period for anyone who's been in immediate contact. And then, obviously, if they're symptomatic, you'd be tested. Sort of, I mean, again, it's across any, let's just use the word congregate, 24/7 kind of facility.
Governor, I'm sorry, I just wanted to ask about the Army Corps of Engineers. What are some of those sites that you guys are considering? The mayor of Boston spoke about it yesterday, that he's also in these discussions.
Yep. He was on the call today.
So we'll just flat out, what are some of these sites?
Well, I'd refer to them more generically than specifically, because obviously there's work has to be done to figure out whether or not they'd be appropriate. But let me just start with the other side of this, which is the Army Corps. What was interesting about this presentation, and the Lieutenant Governor and I were talking about this afterwards, they do this so much that they have literally like a cookbook of models. Right? You know, this is one model we do. This is another model we do. This is another model we do. This one takes this amount of time. This one takes this amount of time. You can put this in this kind of model. This one has, you know, a certain amount of electrical capacity. This one has a certain amount of sort of plumbing capacity. I mean, it's dizzying how organized and structured they are, because they've done so much of this. And so literally it's like they show you what the cookbook is, and then they say to you, the kinds of places we believe our cookbook would work best in your area would be things like college dorms, okay? We have a few of those in Massachusetts. Big venues, if you're not using big venues, but the big test for the big venues is, can they deal with all the issues around electricity and water and stuff like that. They also talked about whether you had nursing homes that were recently, okay, being the key word there, recently closed, that might be possible to do public post-acute work at. It's pretty impressive, actually. And one of the things the command center is going to do is spend some time. They've spent a lot of time already with the hospital community, but the idea now would be to say, okay, now we know what the cookbook looks like. Now we know what the requirements are. Let's go see what kinds of stuff we have that would fit with this particular set of capabilities from the Corps.
And what role would the National Guard play in that, if any? And then just to follow up, if they're not having much to do with that, where would Commonwealth citizens maybe see the National Guard in the next coming days and weeks?
Well, the Guard's role in something like that would be twofold. Number one, they have a lot of people who know a lot about standing these kinds of things up. I mean, that's one of the things the Guard is very good at. The second thing they would do is work in conjunction with the folks from MEMA to chase supplies that would be necessary to both to construct and then outfit a facility like that. What the Guard's going to be doing in the short term, as I said yesterday, is supporting our 24/7 facilities, which they're already doing, and also supporting cities and towns on particular things that, because many cities and towns are shorthanded in a variety of departments because they have people who aren't sick, but who were exposed to someone who was sick and are now in isolation for the 14 days that the Secretary talked about.
How many towns or agencies have applied through MEMA to have National Guard?
I don't know the answer to that.
Governor, I spoke with some mayors yesterday who said that they'd like some help from the Guard as soon as possible. They said that they just are waiting for some more guidance from your administration as to how to go about getting that help. What information do you have for them at this point?
There are regional MEMA directors in every part of the Commonwealth, and they know the mayors, and the mayors know them. If the mayors want to talk about how the Guard can help them, I have to believe many of them are reaching out to their contacts at MEMA. Those relationships are ongoing and constant.
Governor, switching back to the prison for a second, I know that you called out a number of issues with coronavirus that they can't be implemented in the prison facility. Advocates have argued that the folks who are medically, have issues or who qualify for medical post were released. Obviously, lawmakers issued legislation that would go to that effect. Would you support releasing the folks that would be most at risk for coronavirus in prisons?
I'm going to take my guidance on all of those issues from the folks at Public Safety and the folks at the Command Center at the Department of Public Health.
Last question.
Yeah, but
Do
there's
you
been a lot
expect
of
to
talk
see
on.
significant progress in setting up these alternative medical sites this week? This coming week?
I think step one, based on the protocols they showed us, was you need to give us some places that we can come physically see and, take a look at and basically do walkthroughs and then talk to whoever it is that worries about utilities and supply. When I say supply there, I mean like energy supply, water supply, that kind of stuff. The biggest issue for them is, you can have 3 or 4 different buildings that you think might make sense for them, and then the first thing they're going to do is figure out if the wiring and the plumbing is in a position where it makes it possible for them to do whatever the modifications that would need to be done to those would make it possible for them to stand something up literally in a couple of weeks, which is how long they typically say this takes. So goal number 1 would be to basically matchmake a bunch of sites that we think might work with their folks on the ground, who would then say to us, that one could work, that one won't, that one could work, and then take it from there. I don't expect you'll see much beyond the process of actually trying to figure out which sites might be appropriate this coming week.
How challenging is it getting those sites identified, given that a lot of them are empty now, college dormitory rooms,
Yeah.
potentially, hotel rooms potentially, yet at the same time, no doubt, they are as anxious as anyone to transition back to their normal use as soon as possible.
Well, that's another thing. That's actually one of the things the guard said, which was if you have facilities, one of the reasons we talked about nursing homes that might have been recently closed, much more likely to be able to put something together with that because it's already a medical facility, it has bed capacity and all, and it's probably got the right wiring and the plumbing in the first place. The dorm stuff would be driven based on the fact that we've had some colleges that have expressed to us that they would be willing to consider doing this. If it turns out that somebody has some facility that the guard says, or the Corps says, yeah, that would be a good one, but it's one that requires an enormous amount of work to figure out how to actually put something in place administratively, we'd probably move on to some other one instead.
Governor, there's been a lot of talk on bidding on supplies with the federal government. Where does the current stance on that bidding, and how is the state of Massachusetts currently doing with supplies?
So the president said the other day, and these days blur, so I don't remember which, was it yesterday he said it?
Either yesterday.
Was it? I think it was yesterday. I think yesterday he said that he will not get in the way of states bidding on similar kinds of supplies and materials. If states have a bid in, he's not going to get in the way. We immediately put a bunch of orders in with a number of vendors, American companies for the most part, right? And we'll look forward to seeing those get processed.
And what's the second part of the question, what's the current status of the supplies here?
We've said for several days now that we need more gear across the board.
You said as the testing increases, the number of positive cases are also naturally going to increase as well. We've kind of put some graphics together which show the curve, and it's going straight up. Do you feel that what you guys are doing now, I understand that with Army Corps of Engineers that's sort of reacting to this, but proactive measures to prevent the spread, do you feel like what you guys are doing is enough to flatten that curve that's now going straight up?
So keep in mind that curve, the more you test, I mean, if you double the number of tests you do, you're probably going to double or come close to doubling if the trend, if the percentage between positives and total tests stays the same, you're going to double the number of people who test positive. But that doesn't, but the thing everybody should understand is that doesn't necessarily mean you just double the number of people who have it, okay? Because the issue here is to get testing to the point we talked about earlier in the week, where we're doing what we would think of as the same level of testing that you see every single day in other countries, where the combination of testing and chasing, testing, isolation, tracing, That's where we need to get to. And in most of those countries, the way they bent the curve was they bent the curve by testing enough, fast enough, to be able to catch up to the growth in new cases, and then doing the tracing work and isolating everybody. And that's where we got to get.
And Governor Baker, do you think by the time if you have to have a shelter-in-place order, do you think by then it will be too late?
You know, every decision I've made since I got into this was either too much or too little. And I think we should all remember that there are trade-offs associated with every one of these. The economic consequences of these decisions for regular people who no longer have a job through no fault of their own are profound. And if you make decisions to deal with one piece of this puzzle, you better be absolutely sure, especially if it has huge consequences over here, that you're making the right one and you're going to get maximum value out of the decision you make over here.
Governor,